Hi everyone, my name is Alivia Shen, and today I will be speaking to you about the issue of gun violence and its effects on global health. Before I begin, I wanted to share a few things about myself. I'm a rising senior at Danville Senior High School, located in central Pennsylvania. I'm part of the varsity cross country and swim teams. I'm also the president of National Honor Society and the chapter lead of my school's Dear Asian Youth chapter. I'm also the founder of Youth and Peace in Action, which is a club that connects service opportunities from our local hospital to my high school. Lastly, I'm an active hospital volunteer, and I plan to study microbiology or biochemistry in college. So let's start off with some background information on gun violence. Gun violence is violence that is committed with a firearm. Generally, gun violence is most used during homicides and mass casualties. In 2021, 20,958 people died from gun-related murders. Since then, that number has continually increased in the past decade. Even though gun incidents are so common all around the world, gun violence is often referred to as a neglected global health issue. In order to eliminate gun-related events, gun violence should receive more public attention from government and organizations. Gun violence impacts every country globally and is especially a significant burden to many lower and middle income countries. Additionally, gun violence is the leading cause of death for young Black men in America. This demonstrates that it also impacts many communities of color disproportionately. Other than impacting communities globally, gun violence is also a serious issue in healthcare settings. Recently, mass incidents are more common in public areas, such as hospitals and clinics. Generally, these incidents involve suspects, such as deranged visitors or families, and impacts victims, like workers and patients. These gun incidents open risks like restricted access areas that are generally public and patient vulnerability. Gun incidents limit the efficiency in hospitals and puts many workers and patients at serious risk. Gun violence incidents also lead to devastating aftermath, such as trauma, mental instability, and stigma in the workplace. So, now that we know more about gun violence and its serious impacts, we need to focus on a solution. The three main ways to respond to gun incidents is to provide counseling, educate, and change gun laws. Counseling is a great way to help heal trauma for survivors of incidents. Educating is the best way to prevent future gun incidents and prepare communities for such events. Changing gun laws is necessary for states and nations to move forward towards a brighter future. This past year, my local hospital experienced a gun-related tragedy. Like I said previously, I am the president of Youth and Peace in Action, a club that connects our school with the local hospital. As a club, Youth and Peace in Action helped with the aftermath of the gun incident by writing letters to workers and sewing felt hearts as part of the 1,000 Hearts initiative. These letters were delivered to survivors of the incident and acted as a way to settle trauma from the incident. Also, the 1,000 Hearts initiative is a global kindness project that our hospital took on, and it acts as a symbol of kindness during uncertainty through sewing felt hearts. Additionally, we helped our hospital start holding programs to educate students and our community on the importance of gun violence. We introduced two educational sessions called The Management of Aggressive Behavior and Active Shooter. Anyone in our community can attend these educational sessions. Finally, our club externally responded to these incidents by aiding a change in gun rules. We signed petitions, wrote letters to state representatives, and donated to many campaigns. Other ways we can change these gun rules is by attending protests and lobbying government. In conclusion, gun violence is a neglected global health issue that is unfortunately becoming a bigger and bigger issue every year. We need to act on this issue urgently before it is too late. Also, we need to fully recognize that it is an urgent global health issue and support research to help lower middle income countries and certain race populations. Additionally, we need to eliminate the presence of gun incidents in healthcare, especially. Healing trauma, educating communities, and directly acting to change gun rules is necessary for future progress. Healthcare should be a place where individuals seek help, not somewhere that is vulnerable to gun incidents. With gun-related incidents on the rise each year, we must act quickly and effectively to limit and eliminate the presence of these incidents. As a global community, we cannot fail our future generation by allowing gun violence to continue like this. Now, what can you do about gun violence? It is as simple as signing a petition or donating to campaigns such as Sandy Hook Promise or the Brady Gun Violence Campaign. As an individual, it is important to be knowledgeable of gun safety measures and help your community by educating them on gun violence. As a community, we need to be more alert on the neglected global health issue that is unfortunately gun violence. Thank you to my parents and friends for supporting my interest in global health. And thank you to the members of Youth in Peace and Action for sharing my goal of connecting hospitals and schools. Thank you to the Global Health Leaders Conference Committee for listening to my presentation. Here are the references that I used throughout my presentation. Thank you again for listening, and if anyone would like to contact me in the future, here is my information in the form of email and my LinkedIn. Thank you again.